All right, well, welcome everyone to our first webinar on health intersections for this phase of our learning community. So what we're going to be talking about today is screening for the social determinants of health. So I'm going to give a little bit of an intro. We have Tiffany Marley, our project director, with us. She's going to give some introductory information about our learning community, and then we'll be turning it over to our subject matter expert, Dr. Dayna Long. So just a few housekeeping items before we get started. This webinar is being recorded, and so we will have this available after for you to review or share with your colleagues. I'll be running some of the behind-the-scenes technology for today's webinar, so if you have any issues with audio or your connection, you can send me a chat, and you can select in there to send it to the host only. And then also, you're going to be muted throughout the presentation. However, we do want to encourage questions as we go along. So the way to do that is to insert your questions through the chat function. And if you could send those to all panelists, that's the most effective, and then I'll help facilitate those to our subject matter expert once we get kind of to the conclusion of that content or whenever those questions are prompted. And then also, if you do have trouble with your audio, and if you lose audio at any point, but you can still see the screen, you can go up to the Communicate tab at the top of your webinar platform. And in the upper left corner, you'll see that Communicate tab, and you can select Audio Broadcast to then reboot your audio through your computer. You might also have to switch your audio and decide to call in. So there is both the computer audio as well as the call-in function. And then also, as you are looking for these webinar materials after the fact, like I said, today's session is going to be recorded. We will have the slides available afterwards as well, and they will be put directly into our Community Action Academy Learning Community Group course, and so that's where the best place to access these materials will be. We're also going to post them as resources in our Resource Center as well. But I'll be sending out the link for that course in Community Action Academy. And if you don't have an account in Community Action Academy yet, you can create one for free to access all of the resources that are associated with this learning community. So with that, I'll send that link later on, but we'll go ahead and dive into our webinar for today. So as we always start out these webinars, we like to engage in the promise of community action, because this really grounds the work that we do in the learning community, as well as the work that you all are doing nationwide as you look at social determinants of health and helping those in poverty. So as we go into the promise of community action, want to say, community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So as we go on to our agenda, want to just highlight a few things. So we're going to be giving some learning community information to start out, do a few introductions of who you'll be seeing throughout these Health Intersections webinars. And then Dr. Dayna Long is going to be talking about screening for the social determinants of health, looking through some different questions to ask as you're trying to assess clients and individuals. And then we're going to have a question and answer session, and then we'll go through the remaining meeting dates in the schedule as we wrap up today. So as we go on to the next piece, just want to turn it over to Tiffany Marley. She's our project director for the Learning Communities Resource Center, and she's just going to give you a little bit of information about this phase 3 of our learning community that we've just launched. So Tiffany, go ahead and pass it over to you.
Partnership. I would also like to welcome everybody to today's webinar, and really to this learning community group called Health Intersections, which we feel is a space in which we will have an opportunity to learn about the interrelationship between the health of individuals and families that we care for in our communities, and so the interrelationship of their health with their economic realities. And so with that said, we definitely think that our purpose or our focus within the learning community very much undergirds or supports the conversations and the learning that will take place as a part of this series. And what I would like to leave with you as it relates to our purpose is that the learning community exists to help build your capacity to fight poverty more effectively. And through our learning process, we hope that participating community action agencies will have an opportunity to identify those effective strategies which really point to promising or innovative practice models that help to maximize outcomes and help us to analyze those in an effective manner. And we really see our national community action theory of change as also a key foundation or pillar of this work that we're doing as a part of the project. And we understand that this theory of change assumes that as a collective, as the Community Action Network, we are mobilizing communities to fight poverty, and we're mobilizing them in a way that ultimately the 3 goals as specified in the theory of change will be achieved. And as we look at those various services and strategies that are identified in this theory of change, we really see that as the space that we exist in a lot in our learning and in our efforts with the learning community and the Learning Communities Resource Center. And if you look at the various domains specified in the services and strategies section of our theory of change, you will see health and social behavioral development. And so there again, there's another point of alignment as to why this particular focus area, this particular group, and this particular conversation as it relates to health intersections is so important. Just to let you know, the learning community consists of several different groups. We have about 9 groups in operation at this time, and the health intersections group is one of our open learning community groups, along with decreasing homelessness, results at the community level, and cultivating data-centered organizations. And what we would like to say is for all of our open learning community groups, the entire network is invited to participate and can opt in or opt out at any given time. And the other thing that I will call out is that for our intensive learning community groups, as well as our communities of practice, they will also be engaged in some intensive knowledge building, and you will hear about various opportunities to learn with those groups as they are learning about integrated services, financial empowerment for families, and whole family approaches for economic mobility from poverty. And so you will find all of the knowledge building sessions featured in our webinar Wednesdays at 2 p.m. Eastern Time on our schedule. The next thing that I will point out that we feel is important to state related to our framework is that in addition to the specific topics that will be featured as a part of our various learning community groups, those topics will be, I would say, interlaced with connector themes. Those themes including just the whole Roma framework itself, understanding data collection, how all of that relates to the MPIs and our annual reporting and data analysis processes. Also, where we are able, we have integrated themes related to family-centered coaching, trauma-informed approaches, and racial equity. And so the final thing that I would just like to mention is really that our learning community intends to provide a space for agencies to come together, for peers to share and learn and grow together, but to really do that around shared goals as it relates to the topic area. And we really see that the learning community provides an opportunity for all of you who have joined us to connect with peers, but also for your organizations to connect in a way that ultimately maximizes impact or helps to achieve those outcomes that, like I said before, align with our overall performance management framework. And so as a result of doing this, we see this playing out in a rapid way as specified in the definition that we see from the Harvard Center on the Developing Child. And at the end of the day, we hope that through small actions that maybe you will identify and begin to implement as a result of participating in the learning community, that as you engage in those small actions, which we feel are impacting lots of people, that big change will occur within our network. And you can see here just the number of regions. Really, it's all of our regions within our network. It's 33 states. It's 407 counties. And collectively within our learning community, our agencies have their arms around 1.6 million individuals and families. And so if you think about those small adjustments that could be made as it relates to your approach to meeting the needs of these individuals, there's a lot of opportunity for transformation there. And so the final thing that I would like to do is just to acknowledge our learning communities resource team. They work tirelessly on a daily basis behind the scenes to bring webinars such as this, as well as other resources to our network. And so Jarl Crocker is our Director of Training and Technical Assistance. Once again, I am Tiffany Marley, the Project Director for LTRC. And then you've heard from my wonderful colleague, Courtney Kohler, who is our Senior Associate. And then we have Hyacinth McKinley, who is a Program Associate, as well as Liza Porras, who is also a Program Associate on the team. And then Charity Frankowski, who is our VISTA Leader on loan from us from the Corporation for National and Community Service. And then finally, Jean Chapin, who has been a wonderful addition to our team as consultant to our project on our Annie EKC Foundation grant and our whole family approach work. And so at this time, I'd like to pass the baton back to my colleague, Courtney, who is going to introduce our presenter for today. Courtney.
All right, thank you, Tiffany. And so what we're going to do now is I'm just going to go ahead and introduce our subject matter expert, Dr. Dayna Long, and then she'll take off with the content for today. So we've actually been lucky to work with Dayna in the past, and she's presented a webinar previously in our health intersections in phase 2 of the learning community. But we've brought her on as one of our subject matter experts for the series of the Health Intersections Learning Community for this kind of 3.0 of the learning community that Tiffany just talked about. We're excited to have her with us today, Dr. Long, and she's a pediatrician out of the Children's Hospital in Oakland, California, works in the Department for Community Health and Engagement, and has several specialties with asthma, as well as the social determinants of health and health inequities. And you'll see that some of the webinars coming up will focus on health equity. What we're going to be talking about today is really around screening for the social determinants of health, and then some of the webinars moving forward in the series will actually build on the content of today. And she's also the co-director of the FIND program, which she'll talk a little bit about today through the different screening techniques, and a spokesperson for Too Small to Fail, a campaign promoting new research on the science of children's brain development and early learning. So Dayna, I'll go ahead and pass it over to you, and we'll go ahead and dive into our content for today.
Excellent. Thank you so much, Courtney. And I'm really excited to be here with you guys at the Health Intersection webinars. The work on health equity is important to me as a pediatrician who sees kids every single day. And the small change that we want to make that will have a big impact is how do we actually improve health outcomes for all of our kids. So let's get started, and today is going to be a really practical conversation on where do you start. It's the who, the what, the how of screening for social determinants of health. I hope this is a primer for all of you guys that are listening to this webinar, and as we run through the who, the what, the why, the how, I'm really hoping that the participants can ask questions, tell me, what are you screening for? How are you screening? Which questions are you asking? So this is a nuts and bolts conversation. My goal of this is to let everybody know that this is completely possible. We actually can have universal screening for social and environmental needs that impact health, and it can happen at every single site that is part of the Community Action Partnership. So I just want to get everybody on the same page, and it's the notion of what are social determinants of health. And social determinants of health are all of the contextual factors that impact our life, where we eat, sleep, play, and where we learn. And when we look at what determines a person's health, of course we want excellent institutions to provide high quality care. And those institutions have to have care that's accessible. But really, the most of what goes into making a person healthy is what's happening in their everyday life, what's happening in their environment. And if we can wrap our arms around making sure that people have food, people have stable housing, people have access to nature and physical activity, then we can actually improve health on a national scale. When a family comes into contact with any of our institutions, organizations, and agencies, my goal is that every single person gets screened. That screening is universal, and that after we screen, there's an assessment process. And those families that have unmet basic needs, like needing help with utilities, food, after-school programs, that those families will quickly, efficiently be connected to the necessary resources. And those families that have more intensive needs will then get triaged to mental health services, developmental specialists, early intervention services, services for elder care, so that we have systems in place so that once we actually screen, we know what to do about the answers, and then that we can follow up with families. So the first is the who. Who are we talking about? And there are so many different ways to help to start screening within your agencies. And I know there are 45 participants out there. If you guys want to start a chat conversation about who is screening within your organization. So I work at the University of California, San Francisco, Benioff Children's Hospital, Oakland. And within my organization, we have what we call navigators. And navigators are paid staff. They're community health workers. They're advocates. And their job is to be part of the entire team that takes care. And so each member of that team has a very specific job to do and a well-defined role. It is the job, for instance, of the physician to create plans, to create diagnoses, to check on the physical health of the patient, and to actually find out the answers to the other types of survey questions about development and mental health. But it doesn't necessarily need to be the physician who is doing the screening, as opposed to the physician knowing what the answers are. Within schools, there are family engagement and family resource specialists who can definitely do this work. And then we can pilot using different types of staffing models that include volunteers, peer parents, and students. So let's talk a little bit about why I think navigators are so important. So again, navigators are community health workers, care coordinators, and ideally they look like the families that we are serving every single day. They can facilitate trusted relationships between our agencies and the community at large. They're a central part of the team. They are a diverse workforce. They enable all staff to work at the top of their license. And navigators are really good at being efficient and using technology tools that help to increase the capacity of the organization to get the job done. We have used volunteers previously, and let me talk a little bit about what our experience was using volunteers in order to help with the screening process. Our volunteers varied. We had some parent volunteers that we did give a stipend to, and our parent volunteers were exceptional because they've walked in our family's shoes before. They know where the WIC offices are. They know where they can use their food stamps most efficiently. Some of the issues that we had with the family volunteers were that the technology using, whether you use a vendor or electronic medical record in order to screening, sometimes the technology got a little bit tricky for the volunteers, but we definitely were able to work out those kinks. Their highest skill level was in their ability to relate and make families feel comfortable. The student volunteers that we recruited had a ton of energy and passion. The technology was often super easy for them, and what they often struggled with is being able to show up, being able to actually understand exactly what families were going through and knowing what the resources were. We've had large cadres of volunteers. At one point in time, we had almost 80 volunteers who were helping us within our federally qualified health center in order to do screening universally for social determinants of health. And it was quite a process. We recruited from local colleges, universities, including community colleges. We had very strict requirements that all volunteers had to commit at least 4 hours a week for the entire academic year. We had training protocols of which these volunteers had to go through in terms of not only how to engage with families, but in terms of the entire framework of cultural humility, what it actually means to know your own narrative, to be accountable to yourself, to your organization, and to be mindful of other people's experience, and to listen to families as if families themselves are the expert, because every family is a hero in their own life. It required an immense amount of support for the volunteers, not only to sort of track their participation, but we had to provide staff that could debrief with the volunteers, secondary to vicarious trauma, and the volunteers being young in their career trajectories and helping families with very emotionally tough issues, such as domestic violence or discrimination or hunger or homelessness. And then you have to make sure that your volunteer pool is actually sustainable, that they actually commit to showing up even when the semester changes. And during holidays and breaks, that you're making sure that your services are always continuous. And I'm happy to chat more about how to actually work with volunteers for screening. So our staff currently consists of, we have 4 paid staff members that work every single hour that clinic is open in order to support the teams of doctors and nurses and registration staff around screening. The topics that we chose in order to screen for are really varied, and I created a list here, and please chat and tell me if there are things that you guys are screening for that I haven't included on the list. But the topics include food insecurity, housing instability, transportation, access to diapers, activities including access to nature, tutoring, preschool, family activities, the ability just to keep the utilities on, substance abuse, whether it's tobacco cessation or concerns about alcohol or other substances, safety, including gun violence, car seats, bike helmets, cribs, development for children and adult mental health and child mental health. So you'll see a picture of the postcard that we use, and this is a postcard that sits at the front desk at the ambassador station. So as soon as a family walks in to our organization, it also sits within each clinic and at the registration desk. And the postcard just says, please check the following you would like to learn more about. So I want to dive into each of these topics. I know that you guys all were sent out some questions prior to this webinar, and the questions that we asked are, what topics and domains are you currently screening for during the assessment process with individuals and families? And what we learned from those of you that are on the call is that about 20% are screening for food insecurity. So I'm really curious, for those almost 20%, which questions you guys are currently using. I pulled together a bunch of different questionnaires that are commonly used. And as we launch into what are the most evidence-based, statistically relevant questions, I want each of you guys to know that obviously we want to have evidence-based practices. Sometimes the most evidence-based, statistically significant practices, those questions, you have to be careful about the tonality and the face validation. What does this question actually mean in my community? And do some piloting. How would your families like the question to be altered or changed, or how does it land with them? It's really important to know that there are universal national needs, but every community is slightly different, and it's okay to customize the questions in order to fit to your situation, as long as the data that you're capturing is true and authentic data. So CMS, the Center for Medicaid Medi-Cal, recently released a technical report as part of their Accountable Health Communities program, in which they proposed 10 standardized screening questions. And so within this talk, I am using those CMS questions and then pulling together other assessments, including the SWIC, which was developed out of Tufts University, the staying safe and healthy assessments, the assessments that we're using through Find Connect, and then standardized tools that are already integrated into most medical homes. So the typical food security questions, there are two. Within the past 12 months, have you worried that your food would run out before you got money to buy more? And then it's based upon a scale. Is this often true, sometimes true, or never true? And then within the last 12 months, the food you brought just didn't last and you didn't have money to get more. So we actually played with these questions within my clinic, and we tried to really hone in on what are we getting at? What do we actually want to achieve with these food insecurity questions? And where we landed within my clinic is, I really want to know if on a monthly basis, do you need food? Of course, it's great to know what happened 12 months ago, but what about this month? What about today? And so the questions that we incorporated into our program, which is called Find Connect, is, are you running out of food before the end of the month? And then based upon yes or no, do you need food today? Are you currently signed up for WIC? Do you have access to fresh fruits and vegetables? It's really important to think about the types of questions that you're asking and how they actually relate to your resources and your capacity to actually be able to resolve that unmet need. Are there any questions about that? Please let me know and stop me. So again, these are food insecurity questions that come from the Staying Healthy assessment. Are you easily able to get enough healthy food? Do you eat fruits and vegetables every day? And then getting more at the nutritional quality of those foods, do you drink or eat 3 servings of calcium-rich food daily, such as milk, cheese, yogurt, soy, or tofu? So as you pull together your questionnaires, think about the goal. What are you trying to achieve with the questions, and are you going to be able to resolve that issue? So let's move on to housing. From the survey questions that you guys all took, it looks as if 12.5% of you are actually screening for housing instability. So the CMS questions revolving around housing instability are, what is your housing situation today? I do not have housing. I'm staying with others in a hotel or shelter, living outside on the street, on a bench, in an abandoned building, bus, train, or, this question got cut off, or currently doubled up. The next is I have housing today, but I'm worried about losing housing in the future, or I have housing, period. And then the next question is about the habitability of that housing. Think about the place you live. Do you have problems with any of the following? And it goes through the list. So at Children's Hospital, we actually started doing universal screening as part of a larger randomized controlled trial about screening, about the feasibility and the modality of screening. And what we found in that trial was that of families that came to our ambulatory urgent care, 44% of our families endorsed the fact that they had concerns about their housing. This is absolutely in line with the fact that we are in FQHC, so we have healthcare for the homeless dollars because about 40% of our families are either in transition, doubled up, or moved more than 2 times in the last 6 months. And housing often will seem so intractable that we have debated as part of our screening tool is, do we actually even want to ask about housing? Because it's one of the hardest issues for us to resolve. And the answer that we came up with is absolutely, of course we do. We have to ask about housing because housing impacts health. And if we need to advocate on a national policy level for more affordable housing, we need to be able to collect the data, even if at the time there's not much that we can do to get people into better housing. So the questions that we currently ask are you experiencing homelessness? Do you have concerns about unstable housing, including evictions, foreclosures, or staying with friends and family? And do you have concerns about unhealthy living conditions like mold, pests, mice, excess trash in your home? These questions in our system are then actually weighed. And so if a family is currently experiencing homelessness, we will make sure that we put that family in contact with our social worker, that we will call in a 1-800-ACCESS number for which the shelters in the area will report the number of beds that they have, and we'll see if we can actually find a family housing, at least for that evening, and then going from there, more temporary housing. So again, if you guys have questions about these, just stop me.
There are a few questions that have come in, or even comments. So as we go back to the topic of who does the screening, someone said that their agency has a variety of staff who screen and assess, including but not limited to the domestic abuse advocates, housing specialists, employment and training advocates, adult education advocates, Head Start, and then early Head Start advocates. In addition to the items that were listed in the webinar, they also include child care needs, probably because of their Head Start programs. And then in addition to that, we did have a question that came in asking, have you used the Prepare tool for screening, spelled Prapare? If so, how have you built that into the workflow?
So I've heard about Prepare. We do not use Prepare, although I think that the questions are fairly similar. The way that we build these questions into our workflow is that when families come in for their, and I'm going to go through this later on in the webinar, but when families come in through their well child check, and I'll give you a non-healthcare example as well. when families come in for their well-child check, they actually are asked these questions either prior to the physician coming in or as the physician is wrapping up the visit. They can come in and ask the questions. Or the physician themselves, if they uncover that there's food insecurity or housing instability, they can refer to the care coordinators, the navigators, during that appointment. And then the navigators do the screening. They actually do the one-to-one resource matching, and then they create these action plans with families, and they do follow-up with the families either in person or on the phone.
Okay, great. And then there was one more also. How do you coordinate the screening to avoid re-traumatizing households?
I think I need a little bit more context to that question. What I'm thinking the question is that we have a registry. So we have a tech platform. It's called Find Connect, and there are a number of different platforms, and I think all of them have a lot of validity. And so we actually know if a family has already been screened and we just need to do case management or follow-up, or if this is a new family to be seen. And so we actually really are super careful, and we know our families well enough that rather than generating a whole new file, the system will alert us if this family is already registered, and then we can follow up on the screening that's already been done.
Okay, and Melissa that answered the question, she added that you mentioned the domestic violence advocates, the Family Qualified Health Center or Federated Qualified Health Center, and others who are screening. So maybe just the people who have been through kind of sensitive situations and have been asked questions, you know, the same questions a lot. And that last part was my addition.
No, I agree. I think that's one of the huge issues that we have, is that all of us are serving the same families, and that same family moves between the safety net clinic and the food bank and the shelter and the other community serving agencies. And we all work in such silos that we re-traumatize families continuously. And that really speaks to the need for us to be able to work better across silos, to refer to each other, and to follow up with one another, because that's a real issue.
All right, good. And then there was one last one about whether you use HUD's local coordinated entry system that should operate in each community.
I don't know about the HUD system, but I sure would love to find out more about it.
Okay, I think that is it for now.
Great. And so I'm just going to move through the topics, and if you guys see that a topic is missing, there are several more things that we screen for that I'm happy to talk about, but for the interest of time, I just chose the main ones. So transportation is a huge issue for those of us that work in the nonprofit space, about families actually getting to the safety net or getting to their appointments in the WIC offices or getting to the food bank. And so the question that's posed by CMS is, in the past 12 months, has the lack of transportation kept you from medical appointments, meetings, work, or getting things needed for daily living? And then the answer is obviously no or yes. And based upon this, there's actually a lot of movement within the medical space about supporting transportation, whether it's through reimbursements, through Medicaid subsidiaries, or partnering with Lyft or Uber, or having patient care funds in order to get families to their appointments. The Staying Healthy assessment also asks about transportation, and it says, are family members or friends worried about your driving, or have you had a car accident recently? And so this is a different spin on transportation, so this is more of a safety concern. But these transportation questions are on the Staying Healthy assessment. We are currently piloting a program that we are calling FETCH, and FETCH is free and easy transportation for children, where we are partnering with an entrepreneur who's getting philanthropy dollars in order to connect us with Lyft and Uber, because it actually costs less to pay $5, $10 to a family to get them a ride than actually having no-show visits within a clinic. Diapers are actually a huge expense for families, particularly low-income families, and so we do ask about basic needs. Are you concerned of running out of diapers before you have money to buy more? And then connecting families to donated diapers or diaper banks within our area. Activities are huge, so we have a whole bunch of questions about different types of activities that families do and that they can do together. So are you interested in activities for you and or your child to do during the summer that are free and low cost? So as we are entering into early spring, families are starting to think about, what do I do with my child during the summer months when there's no school? Would you like to know about our free nature program? Would you like to know about parks? The more that we can engage families in asking about free and reduced activities, we know that we will improve overall health. Utilities are a huge issue. In that initial randomized controlled trial that we had conducted over 5 years ago now, we found that our top 3 needs were food, housing, and the ability just to keep the utilities on, the water running, the lights on, the heaters working. The CMS questions about utilities are, in the past 12 months, has the electric, gas, oil, or water company threatened to shut off services in your home? Yes, no, or they're already shut off. And do you need assistance? The questions we ask in Clinic through Find Connect are, do you need assistance with your utility bills, such as electric, gas, water, or phone? When we actually analyzed the results for how many families had problems with utilities, it actually surprised us. It was about 20 to 30% of families needed help with their utilities. Safety. So I'm very interested in the participants' response to safety. When we had sent out the pre-webinar survey, actually 0% of those that responded say they currently screen for safety. So we do a ton of anticipatory guidance around safety, so I'm listing the questions that we currently ask. So we actually do ask families, does your home have a working smoke detector? Are you concerned about the water, the temperature of the water when you give your child a bath? Does your home have more than one floor so that we can make sure that there are gates so that the babies and toddlers don't trip down the floors? Do you have cleaning supplies, medicines, and matches locked away? Does your child spend time in a home where a gun is kept? Do you have the phone number for poison control posted in your home? And these are routine questions that we ask universally for every family that comes through our doors. So now that you've sort of seen my questions, I'm actually wondering how many of you are screening for issues of safety that impact health, and what questions are you guys using?
And while people are thinking about that, we did have one other question that came in about the who of screening.
Yep.
So Megan asked, how do you fund the employees who do the screening, and is that time billable?
I love that question, Megan. So this has been a process of evolution for us. So let me talk to you guys about the journey that we've gone through within our health system. Initially, these care coordinators and navigators were paid via philanthropy, through grants, or from research dollars. And what we found is that we needed to gather the evidence that actually showed that we improved efficiency and satisfaction, and we improved health when we asked about these basic needs. The second randomized controlled trial that we published around social determinants of health screening within the safety net demonstrated that we asked families if they had ever universally been asked these questions previously when coming into their medical home. we screened almost 2,000 families, and what we found is that 18, that's right, less than 20% of families said they had ever been asked these questions previously when coming to their medical home. This was in 2013-14. And then we screened families to ask what their main needs were, which was food, housing, help with utilities. And we demonstrated in a statistically significant way that when we resolved at least one unmet social need, we improved child health outcomes. And that was the holy grail, especially for our institution, that we can improve health by, if a child is hungry, getting them food by referring them to the food bank. And then we asked about satisfaction, and about 98% of our respondents said that they were extraordinarily satisfied with the services that they received. So at this point, we now have transitioned to have two funding sources for our care coordinators / navigators. And so the one is that we have secured a commitment from the executive directors of our clinic in order to make care coordination as an operational part of the medical team. And the second is that we really are being supported by some innovative funding streams through our elected officials and supervisors in order to actually pay for infrastructure and operations through county tax measure dollars in order to improve community health. Does that answer the question?
We do have a few people that have, Megan said yes, so
yes.
It did. We did have a few questions or comments about the safety.
Yes.
And so we get back to those. One said that we do screen and we ask about a working smoke detector and about water temperature. She said we don't ask the other questions listed, but they're definitely questions we'll consider adding.
That makes me super happy.
And then, let's see, I think there's one other that came in the question box. So Melissa was asking, what is the reference to find connect in the parentheses after each question? I take that's part of your intake questionnaire software.
Exactly. So I pulled the questions from a bunch of different sources, and I wanted to make sure that I referenced each source where the question came from. And so Find Connect is the technology cloud-based platform that we created in order to synchronize the screening questions with the resources and the knowledge base for the community resources with the referral process, the case management, and then we're able to de-identify the data on a population level to see where the hot spots are and how good we are or bad we are at resolving needs. So that's what that reference is for.
All right. Thank you. And is your cloud-based Find Connect attached to your EHRs?
Yes, it is, and I'm definitely going to get there.
Okay, great. I think that's all for now.
Okay. So I'm just going to continue with the safety questions, and you can think about safety as making sure that you have the equipment to make your house safe, and that equipment is the child locks, the helmets, the car seats. But the Staying Healthy assessment takes it to another place, and they say, do you feel safe where you live? And again, this gun question, do you keep a gun in your house or a place where you live? Do you think others are, do you or others think that you're having trouble remembering things? Do you need help with bathing, eating, dressing, or using the bathroom? Do you have someone to call when you need help in an emergency? And I think that all of these questions are really important. At some point, what we did with our platform is you have to choose which issues you want to tackle, which issues you can actually do something about, which types of data you want to collect. And so I'm just giving you a potpourri of the different types of questions. So this brings us to medical legal issues, and I have an immense amount of respect for medical legal partnerships. There's a lot of these types of partnerships across the country, and each partnership will have a different customization or specialty. The variety of services that are offered range from help with immigration issues, family law issues, including restraining orders, domestic violence, custody issues, victims of violent crime help. We, in particular, ask about if families are being denied basic income, whether or not they applied and their application was refused, or if they're actually not getting enough, or if they're being cut off. And we ask about SSI, food stamps, and unemployment. Families will tell us when we screen for food insecurity that they run out of food by the end of the month. And then when we ask if they're getting EBT, food stamps, otherwise known as SNAP, they'll say yes, but it's not enough food because not everyone in the household is being accounted for. And then there's medical legal help about requesting special education resources or disability. Oftentimes, a family is requesting that a child gets tested by the school and they need an IEP or an individualized education plan. And the medical legal partnerships can either help make sure that the process is started, and if it's not yet started, a letter from the pediatrician goes a long way. Or a family might have an IEP in place, but it's not actually being followed, and medical legal partnerships can help with that as well. So substance abuse. What we found is, especially with the work around ACEs, adverse childhood experiences, that family dysfunction and having a caregiver that is using substances actually directly impacts the child's health. And so we ask a number of questions about substance abuse. The Staying Healthy assessment asks if, do you smoke or chew tobacco? Do friends or family members smoke in your home or where you live? In the past year, have you had 4 or more drinks of alcohol in one day? Do you use any drugs or medicines to help you sleep, relax, calm down, feel better, or lose weight? The questions that we ask with Find Connect are, does anyone around your child smoke? And has anyone from our medical team told you about the tobacco cessation program we have here in clinic or about other resources within the community? When we talk about substance abuse, and now we're going to get into some of the mental health and development questions, it's really important to think about who's asking the question here. For us, it is our navigators, our care coordinators that ask these questions. But if the answer is positive, then we have a triage system in order to then refer the family up the chain of command, whether it's to the social worker or the physician or a trained professional that deals with the particular topic area. I'm not sure how many of you are familiar with the SWIC, but the SWIC is an assessment tool that was developed at the Floating Hospital for Children, and it's stratified by age, but the SWIC has some great family questions in there, and it starts with the script. Because family members can have a big impact on your child's development, please answer a few questions about your family below. Does anyone who lives with your child smoke? In the last year, have you ever drunk alcohol or used drugs more than you meant to? Have you felt you wanted or needed to cut down on your drinking or drug use in the last year? Has a family member's drinking or drug use ever had a bad effect on your child? Any questions about substance abuse screening?
I don't see any that have come through yet. No.
Okay. All right. I know that the participants on the phone, there's a really wide breadth of the type of services that you guys offer and across the lifespan. And so for those of you that see children and families, screening for development is critical. I'm really interested in early brain development with the acknowledgement that the majority of brain development happens in the early years. And if we can intervene early with supporting children and family, it has huge ramifications for adult trajectories. So we ask every single family that walks in, if your child is under the age of 5, are you interested in developmental screening for your child? And then the screening tools that we use the ASQ, which stands for the Ages and Stages questionnaire, and we use the MCHAT if there are concerns about autism. I know some pediatric clinics use the PEDS-DM. When we surveyed the participants prior to this webinar, 6.25% of you acknowledged that you guys do screen for child development. And one of my huge goals would be that if we could actually get that percentage up, it would make a tremendous difference in the life of that child and that entire family. We actually have our navigators or our care coordinators do the screening, and then we have an automated system that helps to calculate the scores and then routes based upon the score the child and family to the appropriate resource. And so these navigators, they're not child developmentalists. What they can do is they can administer a survey and then based upon their results, get the child to the necessary resources. So, child mental health. There are a number of different mental health surveys that you can use, and we ask, again, every single family that is part of coming in for a larger research study that we're now doing on adverse childhood experiences about both the child's mental health and the adult mental health as a dyadic unit. And so we ask questions, are you concerned about your child's mental health? And then we have evidence-based questionnaires that we use in order to screen our children, and these are stratified automatically based upon the age of the child. These questionnaires range from the baby symptom checklist to the preschool symptom checklist to the pediatric symptom checklist. So I just want to go through these questions, and part of the reason why is because I want to make you guys all understand that it doesn't need to be a physician or a highly paid staff member who administers surveys, that well-trained volunteers as well as navigators can actually do the surveys, and the trick is then what to do about the answers. But if you want to have efficient teams where everyone works at the top of their license, it is completely possible that these surveys are then triaged to the appropriate people. And so we've created automatic scoring algorithms for the baby symptom checklist and the preschool symptom checklist. And then this is the pediatric symptom checklist, which is then for the kids that are 5 to 18 years of age. And this screenshot, you can see that it's actually embedded into our EMR here. So moving on to adult mental health. The CMS questions about adult mental health range from how often does anyone, including family, physically hurt you? How often does anyone, including family, insult or talk down to you? How often does anyone, including family, threaten you with harm? And how often does anyone, including family, scream or curse at you? And then the answers are never, rarely, sometimes, often, and frequently. For us, for the current trial that we're piloting around adult mental health, we're asking a number of different surveys. Those surveys range from the ACEs survey to depression screens to anxiety screens. And so I actually want to walk through each of these with you. So the first is the ACEs screen. How many of you on the call are actually screening for ACEs? And Courtney, I'll let me know when there's an answer. And I'm just going to jump to the ACEs screening questions. And I know this is a little hard to read, but there currently are 10 ACEs screening questions. And these are really hard questions to answer. And then there's some people want to answer the questions identified. Some people want them to be de-identified. We piloted which methodology our families prefer, and it actually seems as if when we asked families who were answering the screening questions that were de-identified, and the provider just got a score, that they felt comfortable with the process. Providers, on the other hand, it made a difference to them. Is the family answering, does the family have a score of 4 because they were sexually abused, or is it because their parents were separated or divorced? It actually makes a difference what questions are positive that go into that score. When families answered the question and the provider knew the answer to each question, we asked families how that felt. And what families responded to us was that, of course I want my doctor to know this because it's impacting my health. We are working with Dr. Burke-Harris to modify this pediatric ACEs questionnaire to turn it into a prospective pediatric screening tool as opposed to a retrospective tool that's used by adults. So that prospective pediatric screening tool, we've already done the face validation for it. We're doing the statistical validation, and I hope to be able to share it with you guys really soon. We do screen for adult depression using the PHQ-2, which is actually only 2 questions. Over the past 2 weeks, how often have you been bothered by any of the following? And based upon whether or not families have a positive score to the PHQ-2, it goes on to the PHQ-9, which is a little bit more thorough. And then we also ask about maternal depression, and we ask these questions for all of the mothers of the young babies that come in. And then we're able to notify the physician and the social worker and get mom's resources if we're concerned about depression. And then what I didn't list on there is also the GAD-7 is a tool to screen for anxiety. What we actually found when we've screened adults and children is that of the adults that we've screened, we've asked not only the screening questions, but if they would like more information about mental health support, and about 85% of the caregivers that we've screened have endorsed that they either have a positive screen or they need support around mental health, which is huge. So one of the comments were, how do families get to find? And we actually decided to do a QI project in order to answer this exact question. And so we pulled 573 families in order to ask how did they get to find. And what we found is that well over half, almost 65% of families got to find because they were screened, they were referred by their provider. Otherwise, it was actually the care coordinators themselves. About 20% of families came to the Find desk because they were referred by the care coordinator, but the majority are referred by their healthcare provider. And then, how do you screen? So there are so many different ways to do this. When we first started in 2012, we actually started on paper using an Excel spreadsheet. And we asked the questions on paper, and then we imported the answers into Excel. I actually then have gone to do some fundraising for the program, and there was a tech entrepreneur who had been working in Silicon Valley, and he said to me, Dayna, you're not going to be able to Excel if you're using Excel. And he said, we need to be able to create a cloud-based system that improves efficiency and streamlines the process. that's available no matter what your touch point is within your healthcare system. And so after we moved from paper and Excel to now using this cloud-based system that can be logged into anywhere within the hospital. There are nonprofit and for-profit vendors that are within this space, many of which you guys probably know. And then it's how does this all link to the EMR? And integration with the electronic health record is essential. So there are multiple ways that we currently are working directly with the EMR. So some of our screening questions are built into our EMR platform already. And then families can refer to our FIND program directly through the EMR, just like they would refer to any other medical subspecialty. Whether it be orthopedics, endocrine, nephrology, they just put the referral in as an order through the EMR, and then we can actually schedule appointments through the EMR. Once we actually do a screening and create an action plan with the family, that action plan can then be imported into the EMR, so there's a documentation, a record of what took place. Are there other questions about how?
We don't have any on that just yet, but I did want to go back to, we had about 3 or 4 people that typed in chat to me that they do use ACEs. So we have at least a handful of people on the call that do that. And then we do have a few more questions, kind of going back to the substance abuse questions. Do you find that clients are willing to self-report regarding substance abuse questions? I would imagine that they might have some concerns regarding law enforcement, child protective services, etc.
Really good question. So we anticipated as we launched into our work around ACEs that families would have an immense amount of trepidation and fear when being asked these questions because of reporting to CPS or to other types of authorities. And I have to tell you that that fear has not been well-founded at all. The majority of the time, families are immensely humble and really grateful to be asked the questions because they know that this is impacting their family and the health of their child. And so I think that that is a fear that we often have, but when we actually ask families what their thoughts are about screening and whether or not they think that it is relevant, families say, hell yeah, this is important, and I want my doctor to know, and I want you to do something about it.
Okay, thank you. That is helpful. Then there was one other about, have you come up with some way to improve executive functioning for parents and children, such as referral to specific services, offering innovative services, etc.? I see many of our homeless young families with these issues.
I think I got the gist of the question, but let me just repeat it to you. And so it's asking about how to improve executive function around families that are low income?
Yes, so a way to improve executive functioning for parents and children, such as specific referrals, offering innovative services, so kind of any solutions that you've seen around that, especially maybe with homeless young families.
Yeah, so I'm going to rephrase the question a little bit, put a slightly different lens on it. Firstly, particularly for families that are homeless, like I said, about 40% of our families meet the HRSA definition of homeless, which means that they're in transition or doubled up or sleeping on the streets or in a shelter. As someone that's worked in a safety net and considers myself to be part of the community, I want to say that I think that our families are heroes and that I think that a lot of us couldn't walk a day in their shoes and that families no family wants to be homeless, no family wants their child to be hungry, and that's the reference place where I always start. Now, when families have an immense amount of stress, we know that that stress can actually become toxic stress, and it can affect executive function, and it's trauma, and there are often trauma responses. We are piloting several different types of novel interventions beyond just screening and referral for unmet basic needs. We are piloting modalities such as resiliency clinics. And resiliency clinics are group visits for families who have positive ACE screening, where there are dyadic units of children and families that come in, and we learn about mindfulness, self-regulation, co-regulation. We are screening for mental health, and we're pairing care coordinators with mental health clinicians in order to make sure that we are providing proper assessments and then referring families to short-term therapy and then longer-term therapy. We also are piloting innovative programming where we're actually bringing health to the community and bringing the community into healthcare. One of the examples are food pharmacies, where we're working with our local food bank who, the food bank, they're physically located in a very industrial part of our city. That is a little difficult for a lot of our families to access. We know because we do screening and population health data generation that 1 in 5 of our children are hungry at any given time. And so we do these pop-up farmers markets where the food bank actually comes into the healthcare setting, and we have farmers markets with fresh produce and proteins. Families can get the food for free, and it actually helps the food bank move their food, so they're meeting their deliverables, and it helps us because through our FIND program we're able to actually set up the food banks but also give families prescriptions for food. And so there's a lot of these innovative type models. Another one of the models that we've really been working on is supporting families and children around brain development, early literacy, and numeracy through programs like Talk, Read, Sing, by having reading circles within our clinic. So there's a number of different types of models that we're really piloting in order to support all children and families.
All right, great, thank you. And then we did have another one that came through. I'll go ahead and ask, and then we'll let you finish. So is it only the HCH or medical system that has access to Find Connect, or are you able to do or grant access to community-based providers to facilitate referrals, coordinate care, streamline data entry across agencies, so also minimizing the number of times families have to tell their stories?
Yes. Absolutely, yes. And so I actually think systems like this belong in the community. They don't belong just within healthcare. And so we've worked with our local food bank, and they have their own instance of Find Connect that they can use when families call into their hotline. We also have a really exciting partnership with our local school districts so that in the upcoming cohort of transitional kindergartners, they're going to get screened prior to the beginning of starting school. And we're working with the family engagement coordinators that are within the school district in order to help provide the resource matching, the case management, and the follow-up. So absolutely, I think that it's so exciting to me that this platform is actually going to start to be used within schools and food banks and other community agencies, because that's where it belongs.
All right, thank you. That's all for now, but just to let everyone know, if you have other questions, please type them in and we'll get to them here in a moment as we're wrapping up the webinar.
So that question was perfectly poised, because the next question is the when. When do you actually do the screening, the assessment, the referral, the case management? And I think that the wonderful thing is that there's so much agility here. And so it could be within the pre-clinic visit, it could be during the visit. For instance, if a family is actually waiting for shots or waiting at the pharmacy for medication, it's a perfect downtime to actually do some screening. Or it could be after the visit when you call the family to follow up. Community-based organizations can do this screening as part of their warm lines, the hotlines, such as at the food bank, or schools during registration and enrollment. During back-to-school night, the postcards could be given out, and the family could know where to go if they have any concerns. And then the where. So where do we actually communicate and talk to families that these options are available? As I said, with our clinic at the front desk, we actually put out postcards that families can grab. We do it at registration. It's really nice to be able to do it in the privacy of an exam room because it is sort of a confined, safe space for families. The problem with that is that we never want to hold up a room for the next family that has to move into that room. We also have dedicated spaces, and so this is a picture of our Find Desk here in my clinic where families can come. It's staffed by the paid staff and the volunteers. Within each setting, it's important to find a space where these confidential conversations are happening and to think about how technology can help with that. For instance, if you're doing an ACE screening and you have a mom there or a grandmother with a young child, you might not want to have that community health worker actually verbally ask the families the questions. You can hand that family a tablet or a piece of paper and sort of just sit next to the family as the family goes through the screen or the paper survey. So the goal of all of this work is that we want to be able to disrupt the link between adversity and poor health. And as Tiffany said in the beginning, it's small actions. But if we could actually universally start to screen for mental health, child development, food insecurity, housing instability, we would create this protective buffer that would enable all of our families to have healthy trajectories. So that's it for screening. I'm definitely really eager to answer questions at this point.
All right, I think we had another question or two come in. So Linda asked, on average, how long does it take to complete the screening?
Great question, Linda. So it depends what the family's needs are. So some families, they come and they just really want to know about a particular summer camp. And that might be a 3-minute conversation where that community health worker then gives the family a flyer and a number to follow up with. If you want to go through the entire survey tool and the family endorses that there are multiple areas for opportunity to provide assistance, then it could take an hour and a half.
Okay, great. And then Catherine asked earlier, she's the one that asked about the Find Connect, and whenever you talked about how schools and food banks are starting to use it, she asked, is there a way for the schools or food banks Find Connect to integrate with the medical centers Find Connect?
To be on all the same instance?
I believe so. Yes, that's what it sounds like.
Yes, and so it is absolutely possible in order to be able to share resources, to share knowledge base. Within the medical home, our patient information is HIPAA protected, and so we can't actually pass patient information from the health center to community-based organizations unless the family gives us permission to. And so there are certain areas that are really ripe for sharing, such as knowledge base items. Knowledge base are resource items. And then the patient data itself needs to be behind a firewall just so that we can make sure that we are protecting HIPAA.
Okay, great. All right, well, that is all I see for now. Just to let everyone know, though, just because we're wrapping up this webinar doesn't mean that your questions, if you still have questions as you move forward, I actually just sent out the link to the Health Intersections Learning Community group that we have in the Community Action Academy. So this is our new online learning management system. And I sent that link through the chat box. And so that is where you can access the slides from today's webinars. We're also going to start a discussion forum. And so that'll be a place where you can put in any kind of questions that you're having on this topic or other related topics with the social determinants of health and these different health intersections. And then, of course, all of the upcoming meeting information will be kept in there, as well. So definitely check that out. If you haven't created an account in Community Action Academy just yet, the accounts are free. And it's just a pretty simple process, takes just a few minutes, and then you can access all those materials. All right, well, I'll go ahead and wrap us up as we end up this webinar and just have a few remaining announcements. But thank you, Dayna, for being on our webinar today and sharing all of this really great information. We really appreciate it. We have a lot of other different resources out there that are related to the learning community. So if you haven't signed up already, please make sure you're following our learning community blog. So of course, there's a blog component to it that bridges across all of our learning community groups, which you heard Tiffany talking about earlier. We have about 8 different topics that we are facilitating groups for. And then we also have a number of resources on the blog as well. Speaking of resources, we also have a CSBG TNTA Resource Center. And so this houses all of our resources across all of the partnerships, programs, services, and offerings. So there's a consultant bank, there's a TNTA submission request form that you can put in, and there's also a resource bank with hundreds of resources. So make sure you check that out if you haven't, or if you haven't been in there for a while. So Webinar Wednesdays, that's what we're doing right now. We have these expert-led national webinar presentations on different anti-poverty practices. And so these are all on Wednesdays at 2 p.m. Eastern Time. And a full list of the webinars that we have coming up is on the webinar page of our website. If you go to communityactionpartnership.com, go to the Events tab, and drop down to webinars. Many of them will be listed there, and we'll be updating those as new opportunities are scheduled. And so I already talked about our Community Action Academy. This is really where we can kind of stay connected and continue learning in between the national webinars that we have. Of course, with these open learning community groups, you're not tied to specific assignments, but we want people to get the most out of these open learning community groups. So we want you to connect and participate online as you feel necessary or as you have questions. Maybe you want to know what other agencies are doing around a certain topic within health intersections, or maybe you have another question for Dayna as we move along. This is the great spot to connect and coordinate in between. So on these slides, which are in the Academy also, there's some instructions on how to get access to the site and where to find the Health Intersections Learning Community Group. And of course, if you have any questions, feel free to email me, Courtney Kohler at the Partnership. And then our meeting schedule coming up, we have several opportunities to engage, of course, today with our first one. So we've got that one under our belts with some great questions in our minds to possibly use for screening. And next week on February 28th, I'm going to transition over to this other slide that has some more detail. But we're actually going to be talking about gathering community data on social determinants of health and poverty. And so I just want to highlight this opportunity. It's actually a learning opportunity for all of our open learning community groups. So you've probably seen this advertised before if you're part of some others as well. But this one is really going to look at different sites that you can gather your data from, free sites such as Community Commons or County Health Rankings and Roadmaps, to really get a picture of what the environment in your community is. What is the data that's in your community to tell what that community needs. And so, we talk a lot about community needs assessment and community action, so it'll kind of touch on that data that you gather for that. But it'll also help you think through as you're learning about these different topics such as health intersections or data-centered organizations, and just thinking about what is this environment that we really live in, and give you those tools to look up that community data. Another thing that I think this does in relation to the webinar we had today is, we learned a lot today about the different individual and family level questions that can be asked to assess families that are currently accessing services in the agency. And a lot of these questions can translate very well to the community needs assessments that agencies are doing. So we often get questions about the surveys and, where do we find good questions for our community needs assessment surveys? You know, where do we find these that are kind of standardized and tested? And honestly, the different questionnaires that Dayna talked about today are great sources of example questions to be able to ask in your community needs assessment as well. So it kind of helps to give that, you know, you're assessing with the clients that are in your agency already, but also asking those same sorts of questions, you know, in your community needs assessment as well. And there are questions that have been used across disciplines. So just an idea there, and something that'll kind of bridge us over to kind of from the family level to the community level next week. Then also we have, in April, we're going to be focusing on kind of case management, you know, what to do about all this information that you've gathered through the screening. And so looking at the case management and referral process. Then we're going to be doing a two-part series on health equity. And then in June, we'll be kind of wrapping up this phase of health intersections and talking about impact and evaluation. So all of these registration links are in the slides, which are in that link that I shared with everyone. And then they're also posted in Community Action Academy for people to go ahead and get registered. We also have a quick baseline survey, only 6 short questions, and this is for all of our open learning community groups. So we encourage you to take it because it helps us to gauge the learning and really the impact we're having with the learning community so that then we can make improvements for our open learning community groups. So we tried to make it very brief so it wouldn't take up too much of your time. Then, of course, our staff contact info. Always feel free to reach out to any of us at any time with any of the questions you might have or comments. So our contact information is here on the screen. And as we wrap up our last couple minutes, I will go ahead and take a look and see if there's any remaining questions. So we did have one about where can we access the various assessments discussed in the webinar. Dayna, I don't know if you're still on, but I think that's something we could probably provide a little bit more information about in our Community Action Academy course. Some different links to maybe some of the example assessments that might be available.
Yeah, so I actually was thinking in preparation for this that we should send out the PDF to all of these surveys. And so, Courtney, I can work with you on the article that the CMS tool was published in. The ACEs screening tool, you can just Google it, but maybe we can make some PDFs for all of them and send them out. Okay.
Yeah, or even if they are links, we could just simply post the links in the Community Action Academy site so that they're all there together. All right, and then we had some thanks saying it's a wonderful webinar, and then just about locating the slides. So once you're on the Moodle page, I'll go back to this slide as we kind of conclude. I'll leave it up on the screen for just a moment. But it'll give you the, oh, wrong way. There we go. So it'll give you the access instructions. If you go to moodle.communityactionpartnership.com, if you haven't already created an account, you'll need to create an account first. Then you'll receive an account confirmation via email, and then that'll help you confirm your account, and you'll need to log in. And then if you just scroll down, you should see where you can enter the course categories of the learning community, or there should be a link on the right-hand side that says all courses. Go into the learning community category, and then health intersections is there. You will have to do like a one-step enroll me process, so it's a self-enrollment. So there'll be a button that says enroll me. Click that, and then you'll be able to click the link to go into the course and access all the materials. And once you've done that enrollment process, that course will actually show up on your home page in your courses. So then it'll be easy to access for everyone. All right. Well, thank you all for joining us today. We appreciate your time. Hope you learned a lot, and make sure you connect with us in between on the Community Action Academy. Thank you.